Next, we're going to have Jane Manweiler, who is also a senior research associate at Consumer Reports, and she's going to talk about COVID-19 in children.
Okay, hi everyone. Are you seeing that okay? Yes?
Yes.
Okay. Hi, so I am Jane, and I will be talking to you about our survey research on COVID-19 and children. So this slide, the first thing I wanted to do was kind of set the stage. These results are from our April 2020 survey regarding childcare. And one thing I wanted to mention off the bat was that most of our results for this section, they are reported out of those with children in the household. And that was based on, for this particular question, we had a not applicable type option. For some of our other results, we had a screener that asked if there were kids in the household and what ages. And we did have access to a panel variable provided through our vendor, which we often do use. But for this set of research, we opted to develop our own screener to make sure we were using the most up-to-date information about kids in the home and collected exactly how we wanted it, since that was our central topic. So for this result, early on, as Debbie mentioned, many schools across the country were closing or parents were keeping their children home. And as you see in the graph, 42% of those with children in the home started watching their kids at home. This was a very brand new experience for people. And we even see these very low percentages who were using family members like grandparents for childcare. And at the same time that this was going on with children at home, many of these adults were also working from home due to COVID-19. And so then this is moving on to our May 2020 results and starting to think if there is some hope on the horizon as thinking forward to vaccine development. But what do people think about vaccines for their children? This is very early on, and it's all very hypothetical. Nothing is approved yet, even for adults. So you see the percentages there who say they are likely to get their children vaccinated if it becomes available. And it's pretty split. 60% say very or somewhat likely, and 40% say not to or not at all likely. So then moving on to August of 2020, we were interested in school reopenings. And I will say that the survey design around this particular topic was pretty complicated because it was a nationwide survey, and at the time some school years in August had already started and some were just in the planning mode and they didn't know what they were going to be doing. So we had a lot of kind of extra questions to get at all these different possibilities of situations of where a particular school might be in for a respondent to be able to answer. But so what we have here on the slide is that we asked if it was up to them, what would be their preferred model for school opening, if they wanted fully remote, hybrid, or fully in person. And we also asked what their schools were actually doing or planning to do. And the results were very similar, that about 3/4 said they wanted it to be at least partially remote for both of these questions. But hybrid methods were what was happening most commonly in the schools, but more caregivers actually would have preferred it to be fully remote. And there were also racial differences in which Black and Hispanic Americans were much more likely than white adults to prefer schools to be fully remote. So now I'm going to fast forward for just a sec to December of 2021. And so I just talked about, many people wanted remote instruction for safety reasons, but after they were doing that for a school year plus, we saw that many people didn't really like it that much. More than half of those who were impacted by schools shifting online say it was a negative change that they'd like to see come to an end. And again, we also see racial and ethnic differences, with more white individuals viewing remote learning negatively compared to other groups. Okay, now sort of moving along to the summer of 2021. These results were from May, so leading up into the summer. At this time, many adults were able to get vaccinated. Ages 12 and up for kids had just become available, but younger kids were still not eligible yet. So, how safe or unsafe did parents and caregivers feel it would be for their children to do certain activities? So, some of our results are here, and you'll see that it's around a quarter who thought these activities were very safe for their children to do over the summer, assuming that recommended safety protocols were in place, like dining indoors, going to the pool, traveling by plane. And those with children in the household who say these are at least somewhat safe jumps up to about 2/3. And similarly, we asked how safe they thought it would be for their children to be around friends or family they do not live with over the summer. And we specifically asked about outdoors since it was summertime. And we made it specific that the people they would be around would not be masked. So you see the difference between how people reacted if the person in question their child would be around was vaccinated or not. And 82% thought it would be safe if that person was vaccinated, compared to 60% if the person was unvaccinated. And again, that's unmasked and outdoors. Okay, so now this slide, we have this trend going from May 2021 through to just this past month on child vaccines by age group. And earlier in the presentation, when we talked about child vaccines, that was very early on before anything was approved yet, even for adults. But by May, 16 and 17-year-olds were able to get vaccinated, and we were able to get data on likelihood to vaccinate children at important time points throughout as new age groups gained approval. During the time that the May survey was in the field, ages 12 and up became eligible. Just days before our November survey went out, ages 5 to 11 became eligible. And during the time that the February survey was in the field, we were expecting that under 5 was going to be approved soon. And the FDA had scheduled a meeting for authorization, but then that was postponed. We did encounter some trending issues along the way. Between June and November, we had to revise the age categories. It was originally asked as 2 to 5 and 6 to 11 because that matched up with the Moderna clinical trials. But then we switched to be in line with the Pfizer age groups because those were the ones that were getting approved sooner. So it was a very real world thing where we decided that, having the survey comparability over time was not quite as important as getting the right age groups for what was going on in the world at that moment. And we were also trying to anticipate which months, which ages were going to be most important, because we didn't necessarily have enough space on our survey to ask every age group every month. So that's why you see some gaps in the graphic. And as time moved on, we were also revising our items to include an option for they've already received it as each individual age group was getting approved. And another thing to keep in mind is that the sample sizes were starting to get small for children in the household, depending on how big your overall sample size is. And we typically have 2,000 or more total. So that's enough for us to be able to report by these age groups. But in many cases, we weren't able to do further breakdowns by age, by certain demographics. In some of the previous slides, we were able to do those breakdowns because we didn't ask separately based on the age of the child, just if you had a child at all in the household. So our main takeaways on child vaccines, in May, less than half of all age groups say that they were at least somewhat likely to have their child get vaccinated, but month by month, this was improving, and especially in the older age groups. And as you'd expect, vaccinated adults are more likely to say they will get their children vaccinated, though there were still notable percentages who were hesitant about getting their kids vaccinated. So then finally, what about requiring vaccines for school children? This is from January of 2022, and we're asking about next school year. And most school age students are eligible at this point, and many have already received it. Just about half of Americans agree that students should be required to get vaccinated to attend school. And that percentage drops among those who have kids in the household. and it splits pretty substantially on political party lines, with Democrats more likely to want it to be required than Republicans, and also see some regional differences in which those in the Northeast are more in favor of this. And that's it. Thank you so much.
Great. Thank you, Jane.